Hello, I'm Dr. John Abebe, the Medical Director of Joje Abebe Fertility Center and the lead tutor at the Joje Fertility Academy. Welcome to our Advanced Fertility Training Program for doctors, and this is the Module 2. And Module 2 is the psychosocial aspect of fertility care. Under this module, we'll be looking at four main units. We'll look at emotional impact of infertility, support systems and resources, cultural competence in fertility care, and impact on relationships and family dynamics. Under the emotional impact of infertility, we shall be looking at understanding grief, depression, anxiety, and other psychological responses. We also look at strategies for providing emotional support and referrals. Under the support systems and resources, we shall be looking at the role of support groups, counseling services, and patient advocacy organizations. We shall also be looking at facilitating access to mental health resources. Under cultural competence and fertility care, we shall be looking at recognizing and respecting diverse cultural beliefs, practices, and values related to fertility. We should also be looking at addressing cultural barriers and biases in fertility treatment. And under impact on relationships and family dynamics, we shall be looking at navigating the effect of infertility on couples and family structures, and also look at counseling for relationship strain and communication issues. All right, so those are the various units that make up the module and the various topics under each of these units. So what is the learning objective of this module, psychosocial aspect of fertility care? This module focuses on the psychosocial aspect of fertility care with an emphasis on understanding the emotional and psychological challenges that patients and couples face during infertility treatment. It also covers the importance of providing emotional support, the role of support systems and resources, and the need for cultural competence in fertility care. Additionally, the module highlights the impact of infertility on relationships and family dynamics and provides strategies for counseling couples through these challenges. It is hoped that by the time we are done, the following learning objectives would have been achieved. Number one, emotional impact of infertility. The student would have understood the psychological responses, grief, depression, anxiety to infertility, and develop strategies for providing emotional support and referring patients for additional help. Two, support systems and resources. Learn about the role of support groups, counseling services, and patient advocacy organizations in supporting infertility patients. Cultural competence in infertility care. Understand how to recognize and respect cultural beliefs and practices related to fertility and navigate cultural barriers and biases in treatment. And then impact on relationships and family dynamics. To recognize the effect of infertility on relationship and family structures and learn counseling strategies to address relationship strains and communication issues. These are the strategies that we hope that, these are the learning objectives that we hope that the students would have achieved while going through this module. And do have a wonderful time. And I look forward to seeing you in the module 3 of the Advanced Fertility Training Program for Doctors. Have a nice day.